Most of us, we stress a lot on tobacco and alcohol and less about diet and physical activity.
Right.
But very less about diet and physical activity. No one stresses much on these, which is actually needed.
Correct.
Yeah.
And I totally agree with you because food is really important. I always say, you are what you eat.
Yeah.
I think the good old mantra, what was there, I think, getting back to that really helps us to have good health.
Yeah. And that's the same thing what we are following with fancy terms. What
Yeah.
exactly. So what screening methods that you would recommend for us to follow, especially after you hit a certain age?
I think screening is very essential thing, not to prevent cancer, but to detect cancer very, very early, even before you have symptoms. So in that way, it could be one of the prevention strategies because you are detecting something which did not manifest or which is not going to manifest in the near future. Right. So given that, I think based on the age groups, for example, any women above 40 years of age, get an annual mammogram, an X-ray of the breast for breast cancer screening. Okay. And then monthly once you can do a self-examination. Be self-aware of your breast. Note for any changes. So similarly for cervical cancer, we have pap smear after the age of 35. Right. From 20 to 35, we can do pap smear once every 3 years. If you do HPV testing, the human papillomavirus testing, we can do once in 5 years. So similarly for men, we have prostate, we have a tumor marker called PSA. So above 50 years of age, get simple serum PSA done. Right. So like that, for most common cancers, screening is not for every type of cancer. So if you are above 50, get a colonoscopy done once every 10 years.
Okay.
So if it is normal, you don't have to worry for the next 10 years. So in that way, I think, screening does help in saving lives. Mammography has proven to save lives. So I think I strongly recommend to all our viewers to consider cancer screening as part of their health checkups.
But do you think that most of the patients, what you have seen about awareness, do you think that they believe about screening, or how do you see that this trend has changed, especially in your 2 decades of your clinical experience?
No, I think the question is very relevant. I don't see any change because there's not big take. The screening for cervical cancer is not even 2% in rural area, not even 5% in urban area. Even for breast cancer, less than 5%. So even the educated are illiterate in that sense.
Correct.
So in that way, I have not seen any significant alteration in the trend for screening and adoption of screening. It's not picked up. I think we need to sensitize the communities at large. I think programs like this, what we're doing, I think this will go a long way in communicating the right message.
Correct.
Not to cause fear,
Yeah.
but to make them well informed and take a right decision.
Yeah. Should be aware of, because cancer is totally preventable, and if detected at an early stage,
I would say majority is preventable.
Yeah.
Yeah.
Correct.
Yeah.
And detection at an early stage is also of paramount importance.
Absolutely. The outcomes of cancer treatment depends on the stage. Early detection helps in cure.
Yeah.
One statement I want to make here, Lakshmi, here is because people always compare the results in the West. The cancer treatment is very good in the West. Outcomes are extremely good. Honestly, the majority of the results are good there because most of the cancers in the West are detected in early stage. 70 to 80% early stage detection happens in the West. It is just the reverse in India. 70 to 80% we see in stage 3, stage 4.
Oh,
That's why we don't have good results, and we think that, maybe, we are not managing well, or we don't have a best, infrastructure to manage or equipment to manage. India has the best, infrastructure, healthcare wise, the capacity is wonderful. We have the excellent doctors. See, today, the cancer care is universally same in that sense. Correct. The access to the best of the best medicines, the best of the best technology. See, for example, we have MR Linac.
Yeah.
Right? We have the latest robot, Da Vinci X-ray, Yashoda. Right? So this is possible and it is available, and so at far and at much, much less cost. Right? So in that way, a low cost, accessible, world-class care is available today. So I think the most important thing that I want to convey is that early detection is very much essential, and people should, come forward for screening and get it detected very early.
So before we wrap this episode, Doctor, is there any message that you would like to share with our audience?
I think the message is very clear. Cancer is not a death sentence. Cancer is curable. If we detect cancer early, we can completely cure the disease in majority of the cases. So eat healthy, make your life choices very, very clear in terms of physical activity. The modifiable risk factors, physical activity, less consumption of alcohol, have a healthy diet, and avoid tobacco. I think if we can do this, you're doing a lot of good, not only to yourself, but to the nation at large.